So good afternoon, everyone. Thank you for coming to this session. So this is a session for Healthy City Initiatives. I am the co-chair of this session, Keiko Nakamura from the WHO Collaborating Center for Healthy Cities and Urban Policy Research. The co-chair is there, Dr. Andrew Kiyu from the University Malaysia Sarawak, and then also advisor for the Healthy City Sarawak. Yes, and may I have the introduction session slides? Yes. So this session, we like to discuss about what people can do in the local setting, how community as and local governments and then other stakeholders can make something to happen in the local settings. And then we have four speakers today. I will do the introduction about healthy cities. Then we will hear from Europe, the city of Utrecht in the Netherlands. We will listen to the deputy mayor of Eelco Eerenberg. Then after that, we will hear about so can you show the slide mode? This is already slide mode. Okay, I see. Okay, so four speakers. And then after the deputy mayor of the Utrecht, we listen to the healthy cities in Japan. Mayor Sakurai from Kameyama city will give me a message. Then that will be followed by the presentation by Dr. Kashima from Hiroshima University. And then we will listen to the example from the Malaysia. Then we have the Dr. Rohaida from the Environment Health Research Center Institute for Medical Research here in Malaysia. Then we have plenty of time for discussion. I'd like to have an interaction with you to how we can make a better activities in the local settings. Okay. So first, I will speak about the healthy city approach. So may I have the slide? So actually, healthy cities, so there has been a 35 years experience globally, as according to the recommendations and starting up by the World Health Organization. Slide number 1, please. Not this one. Number 1 slide, please. Then, so currently, so more than 4,000, 5,000 cities are working on the healthy cities. Yes, so healthy city is a value-based urban planning. And then so we share the equity, health and well-being and governance in cities. And then the healthy city care about the people, place, planet. So therefore, the idea, so not only the people's health and well-being, but health and well-being of place, health and well-being of the planet has been in our concept. we we respect that they value the peace, prosperity, and partnerships. Then this Can I move to the next slide? Yes. So the 35 years, and then so the healthy city respect the individual city's characteristic and history, and they develop their own plans and implement in their activities. But there are common key characteristics. There is a health center planning and its implementation with multi-sector partnership. Not only local governments and the private sectors, communities, and NGOs, the partnership is very key. Health city address the physical and social determinants of health, so including urban planning, water sanitation, transport, air quality, urban heat, social situation, health literacy, social connectedness, culture, various things. There is a model of practice for creating health supportive environment. We started to talk about health of people, health of place, health of planet, but we're very much concerned about creating health supportive environment. So not only focus on individual efforts and lifestyles, but to create urban environment supportive health. So this includes urban agriculture for healthy diet, environmental sustainable health, healthy urban transport. Those are up on the agenda of healthy cities. Campaigning for health promotion through multi-sectoral partnerships. Multi-sector partnership, it's complicated, but the cities gradually develop how to work together with different partners, and then city has a lot of experience to do so. A multi-sector steering mechanism is very important. And then, so this will make changes in local legislation, citizen participation, partnership with the private sectors, and political leadership. International networks and health diplomacy. This is very unique characteristics. 35 years of history of WHO program. It's very rare to have such a long life and a project. And then cities are learning together, learning from experience and evidence from other cities. Although the still situation, environment, different, but the idea of creativeness, and then also how people are creating in a different culture background, that will stimulate cities to create some additional thing. Also, that health diplomacy, diplomacy based on the health needs and the environment needs, the group of cities approach to the global community, the national community, and regional community. So that made the healthy city worked for 35 years or so. So this is what WHO think about that SDGs. We have 70 goals, and then definitely WHO is concerned about number 3 goals, health and well-being. But also the health is connected to other 16 goals. It's definitely they are related. And then the healthy cities also, this has an idea, health of the people, the old and the children and the many people, but also concern about how environment or partnership, education, gender issue make difference. Then so they commit to those activities. Example of community heat action plan. So against heat action plans, so how cities are approaching, integrated surveillance and early warning system. So in the close to the community, they have the idea for better warning for the people there. Communication, education. So it's start from schools and then community for senior groups. They know or they create how to speak to them, and then create communication on a path through their efforts. Longer term preventive measures is also important. usual health promotion that makes people better fit, even for the heat stress. So therefore, health promotion in general, fitness promotion, coping skills, so that will be shared among the people there. Sustainable strategies for include landscape, urban plan, land use, building. So it needs long-term efforts and then multiple partners and efforts needed. And then they will create their idea from the local context. Health sector leadership and partner engagement, heat stress, and then at the time there are a lot of medical, definitely there are the medical responses needed, and then but also the prevention and then how to adapt to that one. Health sector can take a leadership by involving other sectors. Climate resilient health system itself, and should call more concern on that one. And then local health sector, local health facilities pay attention to that and climate change by the diversities. WHO has an example to show green and blue space and mental health. Green and blue spaces, there are plenty of places in the cities. How to use those spaces or for sustainable healthy cities. There's one of the examples for some guidelines to show the evidence for the local initiatives. So the idea is the city have a lot of green area, but also a lot of congested housing and other building area. How to sustain the green area and then to link with health promotion. That is the example how cities integrate climate issues in the Healthy Cities project. So this session, we will hear the healthy cities and then how local actions respect blue and green zones in examples. Thank you very much. This is my introduction to share with you what is healthy city approach in 35 years. And this session in particular to discuss around the blue and green zones. Okay, thank you very much. So then next, I'd like to invite Honorable Deputy Mayor Eelco Eerenberg, from the city of Utrecht, the Netherlands. He will speak to us online. It is very early in the morning. Thank you very much for joining us. So the Honorable Mayor, Mr. Eelco Eerenberg, you have the floor, and we will handle your slides from the conference site. Floor is yours.
Oh, thank you, and good afternoon, everybody. And thank you, Professor Nakamura. Konnichiwa to all my Japanese friends, of course, and I hope I pronounced it right, but Sulamat Petong to all my friends from Malaysia. I'm happy to join you by Zoom. I would have loved to visit your conference in person, but alas, there's a lot of discussions going on locally. We have city council meetings, so I'm happy to join by Zoom. I'm going to talk to you about the city of Utrecht, the city that I live in, but also the city that I govern, and how we deal with not only the healthy city approach, but especially the blue and the green zones. Just to kick off, Utrecht is known to be a really pleasant city to live. It's right in the heart of the Netherlands. And together with Amsterdam, Copenhagen, we are considered one of the best cycling cities in the world. And we are a big city in terms of the Netherlands. In your terms, we're probably a village, a small city, but we have 350,000 inhabitants. It's considered big in the Netherlands. But we are lush, we are green, and we are a nice and healthy city. So next slide, please. So I already mentioned that we are in the heart of the Netherlands. The Netherlands has 17 million citizens, inhabitants. We are growing. Right now we are at 350,000 citizens, but we are growing to 450,000, and I will talk about this later on. And this is a picture of our city center. So this is the historic Dom Tower. And here's a fun story to my friends from Japan. Maybe you know this, but there is a replica of the Dome Tower in a theme park in Japan. And we are now restoring our Dome Tower. So it's being renovated. And we sent an original stone from our tower to Japan so that you can put it in your replica tower, and we will be connected. Next slide, please. Again, a picture from our city center. We are 900 years old as a city, but we are way older because when you look at the history of Europe, the Romans actually started a really small village near the waterfront. And from that, our city has risen. And now this same waterfront is a place to visit, a place to relax. And as you can imagine, a lot of students really love to sit and hang around the water. But also tourists from all over the world will visit it. So this is a historic canal, and actually we've forgotten about it. So we are reusing it again. Of course, people are using it to relax and to have fun. But now with all the air pollution, we've started doing city logistics over the water again. So the restaurants, and these are quite a lot, well, if they need to buy beers, there's a boat, and we actually call it the beer boat. But this is just a joke, of course, because it will also bring soft drinks and other stuff. But this will actually go along the canal and oh, is there a problem?
Yeah.
Oh, okay. Somebody's just walking in. And the restaurants will be get their stuff by boat. Next slide, please. Because there's something you probably know from Utrecht, because this is, we call it Nijntje, but it's in Asia known as Miffy. It's invented in Utrecht, and the artist lived in Utrecht. He has passed away. And also Rietveld, who has designed lots of beautiful houses and furniture, is from Utrecht. Next slide, please. So this is a picture that we took a couple of weeks ago, and this is actually the bike lane that I use to travel to the city hall each and every morning, because we are a city that is used by bikes a lot. We have 100,000 bicycles daily roaming through Utrecht. We are a true cycling city. And this is not a coincidence. This is the way we designed our city. So one of my key messages is that the way you design your city, so this is about urban planning, for example, the way you design your city is the way people will use the city. And of course, cycling is a greener option, but it's also a healthier way of transportation. So we've designed a city that we have really wide biking lanes. We have great storage solutions. And actually, there's no way to get at this specific place that we took the picture, there's no way to get there by car. So you either need to take the bus or you need to use your bike. And it might feel a bit of, I don't know, some sort of enforcement, but it really works, because if you make that design decision, people will start using the bike more, people will become healthier, air pollution drops. And of course, it's a friendlier way of moving around. You can say hi to people, and obviously in your car, you're just there by yourself in your own little bubble. Next slide, please. So this is where Utrecht is. I already told this, right at the heart of the Netherlands, and all of the big cities in the Netherlands are nearby by public transportation. So we are really connected, but this also comes with huge challenges, because we are a really nice city to live in, because people can live in our city but work in Amsterdam, or they can even work in Belgium. So lots of people want to live in our city. And again, I will talk about this later on. Next slide, please. So this is one of our key challenges. I already said this. We are a fast-growing city. Within the next 2 decades, I think 100,000 people will try to live in our city. And this is, of course, because we're this nice and lush city, but also because we're in the city, in the heart of the Netherlands. So it's well, easy to live in Utrecht and get along. So we are becoming crowded. Public spaces are becoming crowded, but there are other effects. Next slide, please. So air pollution is rising, noise levels are rising, and we are a healthy city, so we are actually monitoring these things. So these are our data from our data scientists, our epidemiologists. They are really monitoring how healthy is our city. And we are a compact city, so all these new inhabitants will need to start living within the boundaries of the city. There's no way to expand. So more people will add noise, will add air pollution. And our monitoring systems show this, and that shows the need to do something about it. So yes, we are this green, healthy city, but we need to work to stay this green and healthy city. Next slide, please. The differences. We are a city of differences. So you see the map of the city on the left side of the PowerPoint, and the yellow neighborhoods are the neighborhoods where, well, the people are on average, they have a good income, they have a good health, and they have a happy life. The bluish neighborhoods are the other side of the spectrum. So that's where the people live at, on average, a low income, a low health expectancy, and they are less happy. And as you can see, the boundaries are really harsh. So, for example, if you look at the northern east part of the city of Utrecht, you see the blue area, it's called Overvecht. And then you see the yellow area, it's called Noordoost. And it's just one road, that it's the border. And the border means 15 years less healthy life expectancy. So if you live in the blue neighborhood, you'll be living in good health 15 years less than the people that live in the yellow neighborhood. So that's something we need to conquer. I already said we are a bike-friendly city. We really love biking, but these differences are also apply to if people will use the bike, yes or no. So people in the yellow neighborhoods, they tend to use the bike more often than people in the blue neighborhoods. But the people in the blue neighborhoods need to do it more because it's healthier for them. So we started developing classes to learn how to bike in the blue neighborhoods, and that's where the picture is from. So this is just a small example on how we as a city try to lower the gaps between the differences between the neighborhoods. Next slide, please. So another strategy is to keep everything nearby. So if you want to be a healthy city, we say that we want to be a 10-minute city. So this is I think it's a pretty known theory. Paris is also doing this. They are a 15-minute city, but we say that every facility should be in a 10-minute walk, bike, or public transportation. So your school should be nearby, but also green areas should be nearby. And this has two main effects. It helps to be a nice city, and this helps to have green areas nearby. This helps with mental health, for example, because people will go outside, they will enjoy the area. It will also help with climate adaptation, because if nearby each and every house within 10 minutes there will be green, you need to have lots of green, so it helps. But it will also help to lower transportation needs again, because everything is nearby, and this helps with dropping air pollution, dropping noise, and of course getting people to walk around and make them healthy again. Next slide, please. So this is just a small example of how this strategy works out. So this is what we call a barcode, because it looks like a barcode that you have on the products in the supermarket. And the way it works is that for each and every 10,000 houses that we build, we say, okay, we need to add this amount of theaters, this amount of schools, this amount of square meters of green. And this wasn't done before in such a coherent way as we're doing it now. So we cannot build houses anymore without building all the elements from the barcode. And this ensures us that we stay this 10-minute city. And of course, that we have this huge green and blue areas, because as you see in the barcode, most of the colors are green and blue. So this is forests, parks, water, and it helps with climate adaptation, but it also helps with mental health and being a nice city. Next slide, please. Just an example of a neighborhood that we're developing right now. So this is a car-free neighborhood. It will be, actually, it's a park. So now it's an industrial area. We demolished all the companies that were there. It's completely green. It is a park, and then there are houses in the middle of it. There's no way to get there by car. So people need to use their bike, or they need to walk around. And hey, imagine you're a kid. This is a great place to live, because you don't have to look around to see if there are cars that might hit you. And it's green, it's happy, there's water nearby. So this is the future of how we are actually building our city. Compact, green, without cars. And I think it's a great place to live, and it's the future. I think we can go to the next slide, but we can actually skip that because I already told that. Next slide, please. So this is again the same neighborhood as I told you. So you cannot get there by car. It's 10,000 houses. So it's 10,000 houses without any way to get there by car. But we are actually building what we call hubs. So at the border of the neighborhood, you can park some cars, not that many. So of course, if people really need to use a car, they can use the hub, park there, and do the rest by foot. But we are taking it to the next level, and we are implementing car sharing. So the cars that will be in the hub are cars for everybody in the neighborhood, because who needs his own car nowadays? Next slide, please. So this is the topic of today. It is, as you can see, really green. It is climate proof. It is Paris proof, because we try to follow the guidelines from the Paris conference that was there. It's half on half. So 50% of the surface in this neighborhood is green. And I think that's a great score. Next slide, please. So if you look at the WHO One Health strategy, you see there's a lot of content there about animals, biodiversity, because a part of the challenges that we face have to deal with the drop in biodiversity. So when we designed this new neighborhood, well, we also designed it for the local animals. So we have 5 animals that we want to house in this neighborhood along the humans. This helps with spiking up biodiversity, and that also helps with the whole One Health approach and making a healthier city. Next slide, please. So this is the old way of designing a city. So this is I think it's 70% of our city. This is not the way we build our city anymore. I already told you the way we design our city is the way we use the city. And now we're actually changing the old city. So the city that looks like this, parking spaces, room for cars, not that many trees. We are on a street by street strategy changing this. And please go to the next slide and you will see the future. So it will be becoming this. So the place that the car was driving, the road has been made smaller. It is not a car lane anymore, but actually it's a bike lane, and only cars that really need to be there. So that these are, for example, ambulances or people that live in the neighborhood, they can get there. We will add greens. We will remove parking spaces. We will add water. The waste collection will go underground. Well, you can read the slide, but this is the future, and it's already the way we are building our city right now, but we're also changing the old city in this way of building a city. So in the next slide, you can actually see this. This is a concrete example. So the picture on the left side was taken 5 years ago, and the picture on the right side was, I think it's last year. This is the change happening. So more space, more greenery, and also the local businesses like it because there's more place to hang around and buy some coffee or sell some coffee from their perspective. And well, it's happening. Next slide, please, because it's something we are really proud of. This is a picture taken a few decades ago, 2 decades ago, and this was the city center, a 12-lane highway just to get there in the city center. And well, why? I mean, it's not climate adaptive because it generates a lot of heat. It generates a lot of air and noise pollution. And it's not the way you want to be as a city, because who's going to walk there? Who's going to relax there? It's a really dangerous place. And this was the way we've built the city in the post World War II. So and people said, well, the best thing to do is to get the car really fast and efficient in the city center. Well, we've changed that. Next picture, please. This is how it looks nowadays. So we've got rid of the highway. It's completely demolished. We've restored our historic canal because there used to be a canal there in the medieval ages. There's a park. People are actually running, jogging, walking. Children are playing again. It's a really safe space now. It's easy to cross. And of course, you want to take the bike and just stroll along. Next slide, please. So this is the city center. This is the train station. And I think to respect the time schedule, I think we'll go 2 slides ahead because I already promised you. So next slide, please. Yes, next slide. Look, there it is. I already said the way we design the city is the way people use the city. So this is the largest bike garage I think in Europe, but maybe in the world. I don't even know that. But it's 3 stories high. It's 12,000, more than 12,000 spaces to park your bike. And it's right underneath the station. So if you need to take the train, people will take their bike to this garage, bicycle to this garage, and they just go up 2 stairs and they're right in the hall of our central station. And it's a great facility. It's safe, it's dry. And when you have a facility like this, of course, it's free for the first 24 hours. People will use it and people will leave the car behind. I think we'll come to a conclusion. So next slide. Next slide. Again, a great example of how our city changes. So within the next 20 years, a 30% increase of citizens. And the way to make this happen is to not only add housing, but use this barcode and add green, add water, add facilities, get rid of parking spaces, get rid of roads, and make it a nice, green, lush city that people want to live in. And the picture that you see used to be a railway, and we've turned it into a park. Next slide, please. Of course, something we cannot do on ourselves. So this is a Dutch slide. I'm sorry about that, but basically it's saying that if you want to change the city, you need to do all things together. You need to change your energy system. You need to change your greenery. You need to change your mobility strategy. You need to change the way people live, because people will live in smaller apartments, and the buildings will become higher. So there's space left for the parks that surround it. So you need all this to do all these changes on all these topics at the same time. And then as a final conclusion, I will go to the last slide. So next slide, please. It's the last one, I promise you. There it is. So this is the future. And this is a school. You're looking at a school, a primary school, and we've created a bicycle lane on top of the school. There's a park. There's a waterway to the right. You can see it. You need to look very good, but there's a waterway to the right. There's a bicycle lane. There is a school. So the future is also combining stuff on the same space to make it happen. Because if you would have made all these things separately, there will be no room for green left. But when you combine things, there's room for green. And this is a really healthy space because people will use the bike. The children have this green area to play. There's even a little farm on top of the school. I hope you can see this. So the children eat their own foods. And this is, of course, a healthy way to eat. There's a waterway to enjoy. This helps with the mental health care. So, yeah, you can actually design a healthy city. Thank you very much.
Thank you very much, and Mr. Eerenberg. So the great example from the city of Utrecht, and then so a lot of were dynamic changes and then planning. So Mr. Eerenberg will be with us in the next 10 or 20 minutes. So I would like to take questions, and a specific question to Mr. Eerenberg now. And then if the QR code for taking questions, and please share it with us. And then other in the floor, please raise your hand, and the microphone will be there. So yes, there's something.
Hi, thank you very much. George Downward here. I'm actually from the city of Utrecht myself, and I'm here representing Utrecht University and UMCU. So I can actually be very happy to corroborate pretty much everything that's been presented here. The question I wanted to ask, or to give the opportunity to discuss with Mr. Deputy Mayor, is how is the collaboration between the Gemeente Utrecht and the academic centres to sort of try and identify or navigate healthy environments for the population?
Yeah, thank you. That's a great question. Yes, we are collaborating because we have, of course, this beautiful and historic university in our city, but also a great University of Applied Sciences. And we're working together on different topics, and we try to be a living lab, so to say. So we try to see if we can try things in our city that are thought of by these great scientists, and you're probably one of them yourself. For example, we work together in what we call a health hub. So this is where we try to have challenges on how people live a healthier life, and see if we can make the connection between companies. So there's also room for innovation and technology. The educational partners, so this is the university, see if there are new insights, and our more practical city-oriented approach. And we try to combine these three viewpoints into tangible solutions for the people in our city. So yeah, we do collaborate.
Hi, Patrick Lee from Malaysia. I'd just like to ask, how difficult was it to transition from a car-centric city those few decades ago, from the pictures that you showed, to what it is today? How much opposition did you face in trying in that transition, and who did you have to convince? How did you convince them, and how difficult was that?
Yeah, great question. I think most citizens actually supported this movement. So, because the people didn't like this car-centric city. I mean, maybe the first decade they liked it, but then the downsides became visible. It's not a great place to live alongside these highways, for example. So the citizens really wanted some change. The difficult part was convincing the companies, because they said, if people can get here efficiently by car, we will earn more money than if you make this impossible. And this turned out to be not true at all. So we've monitored this, and it turned out that if people go to places by bike, they actually spend more. And that was a huge game changer. So now it's turned the other way around. Now we have companies that say, hey, can you transform my street? Because I want this room. I want people to come here by bike. I want to have a larger place that people can buy coffee. But this was a hard part. But now we have some evidence, and that really helps.
Thank you very much. So thank you very much, and Mr. Eerenberg. And yes, the city of Utrecht is one of the leading city of an WHO European Healthy City Network. And then so this experience is shared not only within the city, but also other cities in Europe. And then today, so the experience is shared with the Planetary Health and the communities. Okay, so one more questions, yes.
Thanks very much. It was a very interesting talk. I had a similar question about the politics and any challenges you had convincing not only with the cars, but to convince people, that people that maybe are now living in houses, how do you convince them to move to somewhere smaller, to move to an apartment, and when you're trying to redevelop these areas, how do you convince people, that bringing more people in is not gonna, cause congestion in public services, in the bike lanes, even things like that? Have you had any challenges with the politics of getting people on board with that? And what lessons do you think you have from that could be applied in other cities where there are seemingly a lot of political challenges to getting these kind of green city initiatives passed? Thank you.
Yeah, great question again. And of course, this is difficult. Well, there's one thing that really is helping us is we are facing a huge housing crisis. So there's a really big shortage of housing in the Netherlands, and especially in the cities. So, for example, if you need to use our social housing, you need to wait 10 to 12 years to get a house. And this helps because then people understand that you need to build more densely, more compact. So that's one of the drivers that allows some, that helps with the change. Funnily enough, another driver is that we are actually doing it, and this shows the results. So the first neighborhoods that are designed in this new way are now rising. And yes, there are people who said in the beginning, this ain't gonna work, this isn't the way I want to live. And now that these new neighborhoods are there, they are fishing it and they're saying, hey, it looks nice. And this might actually be a place for me. Another thing is that, well, the new neighborhoods are these smaller apartments, but the old neighborhoods are still there. So there's still a house for everybody. And yes, we are also changing the old neighborhood, so the parks will go out, etc. But we won't be demolishing houses there and start building high rises. Not yet. I don't know what the future will bring. And again, yeah, of course, there are people who won't like this concept at all. But it's also the way you design your city is the way people use your city, but it's also it also attracts it also attracts people. So I think we are a young city, lots of students, and students want to stay, and these young people they tend to be more progressive, and they tend to like this way of city building maybe more than the average countryside, for example. So that also helps. But yeah, there are debates, and it's not easy.
Thank you very much. And so we have learned, so this is not so easy. And so there are difficulties, but we witness another changes over the years. So the one question online, can you, the technical people, share that question? Or if not, Okay, so thank you very much, Mr. Eerenberg. And so then we took his a lot of efforts, and then we have learned a lot. And the city leadership without the deputy mayors, and so that those connections didn't happen. And then thank you for the joining this hearing afternoon, your place in the morning. Thank you. So next, we have the example from Japan. Then first, we will hear from the mayor of Kameyama City, Mr. Sakurai, and he will speak in Japanese for those who do not understand Japanese, but also please listen. So that reason Japanese language, and I will tell you something. And then that, so the translation will be followed.
皆さん、こんにちは。ただいまご紹介に預かりました、健康都市連合日本支部の支部長を務めております、亀山市長の桜井義之でございます。昨年11月には、WHO の健康都市国際交流プログラムが開催され、欧州の健康都市連合に加盟する6カ国の代表者が来日をされ、国内外の健康都市連合に加盟する自治体との貴重な交流機会をいただきました。ブルーとグリーンの健康都市の展開をテーマとして交流させていただく中で、単にこの健康を追求するのではなく、自然や環境などあらゆる要素が健康都市の実現には必要であるということを再認識する大変意義のある機会にもなったとございます。さて、亀山市では現在、将来都市像緑の県と亀山の具現化に向け、健康を軸とした市民の新しい学びと交流の場の創出を目的とした亀山健康都市大学の創設や、健康管理アプリの活用による市民の主体的な健康活動の促進など、市民の健康とウェルビーイングを見据えたさまざまな施策を展開しています。このような中、亀山市のプラネタリーヘルスへの実践的な取り組みといたしましては、2019年には亀山市鈴鹿川と源流域の自然環境と歴史的資源を守り継ぐ条例の制定、さらには産学民間が連携協力したプラットフォームとして立ち上げた鈴鹿川と源流の森づくり協議会の活動など、現在も生物多様性の保全に向けた施策を積極的に推進しています。一方、昨年7月には、国内でも先進的な取り組みとして、事業者、民間団体、個人など、多様な主体により保全されている市内の OECM を認定する亀山生物多様性共生区域認定制度を設けました。こうした取り組みは、国の施策から一歩踏み込んだ施策であるとして、さまざまな方面から反響をいただいているところでございます。今後もこうした自然を守るさまざまな施策の推進を通じながら、今回を機にプラネタリーヘルスへの貢献や都市のグリーンとブルーに関連する自然環境づくりについて改めて課題認識として共有し、取り組んでまいりたいと考えるところでございます。今後、人と自然や地球環境は密接に関係していることに注目し、地球上すべての生き物の健康に配慮し、人と地球の健康のバランスが取れた健康都市を目指すことがますます求められます。皆様とのご縁を大切にしながら、今後も継続して健康都市亀山を目指したまちづくりをしていきたいと考えています。引き続き、今回のますますのご発展を記念いたしまして、私からのご挨拶とさせていただきます。貴重なお時間をいただき、ありがとうございました。
My name is Yoshiyuki Sakurai, the mayor of Kameyama City, Mie Prefecture, Japan. Since July 2023, I have been serving as the chairman of the Japan chapter of the Alliance for Healthy Cities. November last year, the WHO Healthy City International Exchange Program was organized. Mayors and then representatives of European healthy cities from 6 countries visited Japan. We had valuable opportunities to interact with each other, both domestically and internationally, concerning experiences of healthy cities. The theme of the program was to develop a blue and green healthy city. We are reminded that we are not simply pursuing human health, but that all elements such as nature and the environment are necessary for the realization of a healthy city. It was also a very meaningful opportunity to recognize this. The vision of the city of Kameyama is to realize a green, healthy city Kameyama. As one of the programs to make this vision a reality, Kameyama Healthy City University was established. The university aims to create a new place for citizens to learn and interact centers on health. We are developing a variety of measures with an eye on the health and well-being of our citizens by the creation and use of health management apps and the promotion of citizens' independent health activities. Under these circumstances, as a practical initiative for planetary health in Kameyama City, in 2019, we announced a project to protect the natural environment and historical resources of the headwaters of Suzuka River in Kameyama City. We are currently actively implementing measures to conserve biodiversity, such as enactment of the succession ordinance and the activities of the Suzuka River Headwater Forest Creation Council. This was established as a platform for collaboration and cooperation between industry, academia, and the private sector. Meanwhile, in July last year, we had established the Kameyama Biodiversity Symbolic Area Certification System. So this is an OECM, areas that contribute to biodiversity conservation other than protected areas, and an initiative which is very much advanced efforts even in Japan. Multiple sectors are participating in these efforts, from business operations, private organizations, and individuals. These initiatives showing advanced steps beyond national policies and are receiving feedbacks and comments from various partners. While promoting various measures to protect nature, we will take this meeting as an opportunity to share our awareness of the issue and work on contributing to planetary health and creating a natural environment related to green and blue cities. I hope to share our experiences with you and continue our efforts together with you. From now on, we are expected to pay more attention to the close relationship between humans, nature, and the global environments. Healthy cities are further expected to create a city that balances the health of people and the earth by considering the health of all living things on earth. While valuing in the relationship we have with everyone, we would like to continue to develop the city to make Kameyama a healthy city. I'd like to conclude my remarks by wishing for the success of the summit and the session. Thank you very much for your valuable time. Now, I'd like to invite Dr. Saori Kashima from Hiroshima University to share other examples from Japan.
Okay, so hello everybody. So assalamu alaikum and also konnichiwa. And I'm Saori Kashima from Hiroshima University. I'm director of the Center for the Planetary Health and Innovation Science. So today I try to share some experiences of the in Japan, plans and action for the healthy city, nurturing the green and blue zone. So, but now in Japan, so like this photo, so the color is not only the green and the blue, but also the color, pink color. You can enjoy the sakura and cherry blossom blooming in this season. Just I took this photo before coming here. And so I don't have any COI to disclosure for this presentation. Okay, so I tried to pick up the three background for in Japan for my presentations. First background, it's kind of the issues. It's like it's not the issue. Background is like now the people's lifespan is extending, as you know, and then so the globally in the many countries in the global level, so they are facing the aging society, and then so the United Nations they just started the they launched the new program of the decade of the healthy aging, as you know, since the 2020. But as you know, in Japan is already facing the super aging society. So the proportion of the person aged 65 years old over is like in 2022 is at 29%, and then it is projected to be 37% in 2050. So this is like a 1 in 4 person is like elderly people. So Japan is like a leading leading country of the healthy aging. And then so I tried to pick up another background. So there, as you know, nowadays the increasing the tendency of the natural disasters. It's natural disasters. It's increasing. This was not happened in Japan only, but also also your countries also similar situation you are facing. So this graph is showing the number annual trend of the occurrence of the torrential rainfall in Japan since the 1976 to 2012. And as you can see, the number of the heavy rainfall, it's increasing by year and year. And then so, of course, this trend is continuously occurring in this decade too. And then so this meaning is the heavy rainfall occurred. This meaning is like we are the severe flood were occurred in many places in Japan now. And I explained about nowadays Japan is facing the super aging society, and then also this background is increasing the natural disaster. So this meaning is the vulnerable people to the natural disaster is increasing more and more. And also yesterday night, we had a severe, heavy earthquake in the western part of Japan. So as you see there, as you know, there in Japan, we are facing we are having the many natural disasters. And then so the vulnerable population is increasing. So this meaning is a healthy city project. Also, we have to considering these two backgrounds. And then so we are doing the one research. So in 2018, so in western part of Japan, so heavy rainfall were occurred and the severe flood occurred in the western part of Japan. Hiroshima is located in the western part of Japan. And then so see like this photo, so many places were inundated and flooding were occurred. And then so just we evaluated something like after the disaster, after this severe flooding, so the dementia, risks of the dementia will increase or not. So we are evaluating that by using the national insurance data set. And then unfortunately, we observed that after the disaster, among the affected people, the risks of the dementia is increased was increased comparing with the non-affected people. Like as I told you, the elderly people is vulnerable to the natural disaster. So this meaning is that many of the diseases and many of the symptoms were occurred after this kind of the natural disaster. So I think in the Healthy City project also we have to be considering these points too. And then so from now, I try to introduce the Japanese experiences in the plan and action for the Healthy City. And I want to introduce the 3 cities project. And one is the Taito City in Tokyo. And another one is the Obu City in Aichi Prefecture. And also the mayor of the Kameyama City, you saw the video. So it's located in the this black star mark area. And my prefecture is Hiroshima. So Hiroshima is located in the western part of Japan. I want to introduce these 3 cities project. Oh. And then so first one is I'm trying to introduce the effort in the Sumida River, Sumida River in the Taito City, Tokyo. So in this area, so many of the area in this city, so located in the lowland. And then so there, because of the heavy rainfall, and also this city is located close to the sea line. So this means is the tidal wave, high sea level was also occurred. And then many places were inundated, and like these photos. And then so the Tokyo metropolitan government, so they try to establish something like a tidal wall in the right-hand side photos in the around the 1963. And then so they're almost, this map showed something like a project of the Sumida River for making these constructions. And it is almost completed. 90% of the construction was completed already. And then so, but this no pointer. Okay, so in this photo, as you can imagine, this type of the high wall is spreading the people's life from the water and from the river. So this is not we can, if we they've constructed this type of the wall, of course, we can prevent to the occurring the inundated and flooding, but the people's life is separated from the river. And then so that's why nowadays, so they are establishing something slope embankment was built in conjunction with the developed hinterland to improve the seismic resistance and connected with water. And then so this one is the like gently slope embankment now. And also the mayor of the Kameyama City is Mr. Sakurai. So he mentioned they are receiving the WHO Euro Healthy City Inter-Exchange Program. Also, I joined that. And then at the time, also I enjoyed riverside walking in this new embankment. It was very much interesting. This riverside, so the many private shop is also open, and then it was very much interesting experiences. And then also I would try to introduce a second city. Name is Obu City. The Obu City is total population is like a 29,000, over the 29,000. And then so this Obu City is provided many fluent services for the elderly people. As I told you, Japan is facing the aging society, super aging society. And then so something like services for the elderly people is also very much important. And then so they try to achieve to establish a town with zero anxiety about dementia. And then they provided many services to the elderly people, and not only the elderly people, also the family who are living with the dementia. And then so this of city is like over 200,000 dementia supporters they're registered in this city. This is kind of maybe around the 20% of the total population. And then so through these activities, so they are making something like a watching supporting system for the elderly people. And also they are opening the cafe for the dementia people and also people with dementia and also the people, family living with the dementia. And then so these kind of the software they are establishing. Of course, they are try to develop something like hard environmental tool, like these photos. If the people, elderly people go out, of course, the same city is very much important. So now they are establishing like a safe city where people can live with peace and mind, like these photos. So this is kind of the city is establishing the hard and soft age-friendly environment. And then so also the participant of the WHO Euro International Exchange Program, so they are visiting and joining. Okay, these activities, and then also this photo show the bottom of the photo show something we are enjoying something like a tea ceremony. This was very I got a deep impression because the people who are over the 80 or 90 years old, lady and gentlemen, have the tea, traditional tea. So all participants really enjoy that. And then so I would try to introduce one more background. So as you know, now we are facing the great acceleration. And then so even if we develop the local policy and actions with consideration on the human health, so without the health of the planet, it is hopeless to achieve the healthy aging in the future. As you can imagine, you are working in the planetary health field. And then so this is our project. So we just launched the transdisciplinary research for the planetary health. And then so as I mentioned, only focusing on the human healthy aging is not enough. Also, we have to considering the healthy aging, healthy aging in the social systems and also the healthy state of the natural system too. And then so we call this area, which 3 area field was covered, is like a planetary healthy aging. Just we make these terms. And then so we targeted this planetary healthy aging area. And then we try to develop the comprehensive index to measure the local resources, local commons, including the social systems and natural commons too. And also we want to visualize the issues through this comprehensive index. And then so now we try to develop this in the transdisciplinary research members. So as you can imagine, this comprehensive index is not only the health science researcher, but also we have to collaborate it with the other researchers. So this is our members. And then so some researchers is coming from the urban planning, and also some coming from the water resource management, and some of them coming from the ecological field. So now we're sitting together, and then we try to discuss what kind of index we have to measure for achieving the planetary healthy aging. Of course, not only the academic part, also that we are collaborating with the many stakeholders to develop this kind of the comprehensive index. Because the participation is very much important in the Healthy City project. So participation meaning is the local community people also have to develop and consider their healthy city plan. And then so we want to involve many of the participants from the other stakeholders too. And then as I mentioned, this is our final slide is going. So final slide is not here. And so, as I mentioned, the UN is now launched up the decade for the healthy aging. But we hope to do like a decade for the planetary healthy aging. So we want to input the planetary health concept into the healthy aging concept. So now we are doing. So thank you very much. Yeah, thank you.
Thank you, Dr. Kashima. Thank you for the integrating and various efforts in Japan. And then we will take your questions after before we have the discussion. And then now I'd like to invite Dr. Rohaida from Malaysia to tell us about the eco-health approach from a Malaysian experience.
Thank you, Prof. Keiko and Prof. Andrew as co-moderator today. Assalamualaikum warahmatullahi wabarakatuh, and a very good afternoon. So basically, I would shorten my presentation since we have time constraint. So basically, what have been presented before this are examples of the healthy cities, especially in Asia. But how do we link between the climate change, health, and to integrate the eco-health within that concepts? Okay, for eco-health, I'm sure some of you haven't heard about eco-health. It's the relationship between the human systems, which is about our health, the social, economy, and also environmental health, which about the environmental degradation, the ecosystems, and showing the interaction that have the co-benefits with human, especially as you're aware right now. Today, there's a news about a volcano eruption nearby within the Southeast Asia, the Mount Ruang. So the interaction between the ecosystem and human health is very much related to the clean air, clean water supply, provision of food and medicines, and also the habitat for the natural and also wildlife. So at the end, both the ecosystems and also the societal systems on the for the human health, it will impact us in many ways, especially for the vulnerable population. We are looking into the age-specific population, the children, the elderlies, and gender-specific, especially females, the marginalized population, the socio-economic deprived, poverty, and also people with living with comorbidities or some chronic diseases or disability. So as we listened through the whole session for the past 2 or 3 days of the meetings, we realized that the IPCC had stated that in 2022 that we must limit the temperature rising up to 1.5 degrees Celsius. And in fact, the previous report showing that if the temperature increased to more than 2 degrees Celsius, the impacts will be more as compared to 1.5 degree. So the effects is actually the whole systems for the human on the health and well-being, the water supply, and also food production, and the cities and settlement and infrastructure, biodiversity and ecosystems. The biodiversity, even it is the terrestrial or the land or inland flooding, we can say about that, the freshwater systems and also the oceans. These biodiversity and ecosystem are very much affected our lives. So what I would like to share about the climate change and health impacts in Malaysia that involve the urban area. As we can see that in the maps showing the spatial patterns of a heat wave in Malaysia for the past few years, both in terms of number of heat waves and also the frequency of heat waves, are more towards for the Peninsula Malaysia, are more towards the west coast of Peninsula Malaysia, and it involves multi-cities, a few cities along the west coast of Peninsula Malaysia. And as you can see, the graph below the maps, it shows that the disease that being reported for the hospital admission for the past 5 years, we can see that the peak are actually related to the episodes of heat waves, and it occurred during the El Nino phenomenon. So there's increased number of hospital admissions related to extreme temperatures. And one of our study, we look at into the association between the ambient temperature with the non-accidental or natural death in Peninsular Malaysia. It's being done at the actually northern parts of Peninsular Malaysia. And it showed that the cumulative effects of extreme hot temperature in relation to MMT or mortality, minimum mortality temperature at 28.4 degrees Celsius, it showed that there's increase of risk at shorter leg of 0 to 7. And these extreme temperature effects are more towards the females, elderlies, and those who are living in urban area. So with that, in 2021, the Ministry of Health came out with a guidelines. It's an action plan to improve the monitoring systems of the heat-related illnesses. And we targeted that the population, certain vulnerable population, including those who are living in the urban area, to have a better health promotion, to have better awareness on the heat wave. I noticed that the questions on the transportation just now, looking into how we encourage people doing, cycling or something in our hot weather. So that is a really challenge for Malaysia. And for the NCD or non-communicable diseases, in the morning, we heard about the eco-anxiety, the mental health challenges that related to climate change. And a study in Malaysia, among the youth in Malaysia, showing that about 60% of youth in Malaysia, actually, they have like climate anxiety, which described as being afraid, powerless, guilty, helpless, and set towards the climate. So one of our study in Klang Valley in Kuala Lumpur on the relationship between the urban built environment and also cardiovascular hospital admission, showing that the land use that for density of road junctions are actually associated with the increased number of hospital admissions. The maps are actually showing the Kuala Lumpur maps. So maybe the center is the hospital that are involved. Hospital Kuala Lumpur, it is the tertiary center, a public hospital that receive referral from the Klang Valley and also all over the country as well. But looking into the recreational density, at that time we're looking into the recreational we define as the greeneries and also some lakes or blue space. It actually reduced the cardiovascular hospital admissions for the Klang Valley. And infectious diseases. For infectious diseases in the urban area in Kuala Lumpur, the Kuala Lumpur City Hall had been doing some efforts on the control and prevention of vector-borne diseases. We know that especially dengue, it happens in the with relation with, of the urbanization, the migration, population mobility that leads to the increased number of infection. And for Institute for Medical Research, our colleagues have established the Wolbachia is a gram-negative bacteria to be put in the Aedes aegypti mosquito, and it would eventually to reduce the number of cases of dengue as compared to the control group. And the release of this mosquito has been done in Kuala Lumpur. So this is one of the eco health that, I mean, the ecosystem, we control the mosquito, apart from other intervention. For example, we do the community participation, do the community behavioral intervention or combi, so that the community would help in reducing certain diseases such as dengue. So what are actually the role of health sectors? If any one of you aware or attended the last year Conference of Party of UNFCCC, the COP 28 on in Dubai, there's a declaration by most of the parties, most of the countries that involve in the commitment for the conference which related to Paris Agreement. So this is what we in the Ministry of Health Malaysia has like pledged or committed to do in the next few years, so that we want to build climate resilience, especially for the healthcare systems, and to help in mitigation and adaptation in climate change, especially in the urban area. So as conclusion, climate change is actually a major threat for this decade for human and also ecosystems. And it continues to affect the distribution of the climate sensitive health outcomes. And we in the public health sectors are responding in various ways, especially in the multi-sectoral engagement and to have community participation in the program. With that, I thank you.
Thank you, Dr. Rohaida. And then now, and also please all speakers and moderators on the stage. Yes. We have yes, only short time with us. So that then actually we have a plan to have a panel discussion, and then there is several discussion theme. But before going that, so we will take questions to Dr. Kashima and then Dr. Rohaida. And then so to Mayor Sakurai, maybe some, if I can answer, I can do that. Any questions? Okay, so the later is fine. And then so for online questions, yes, so thank you very much. And so this was the question to the Utrecht mayors. So mayors and so then and so you can add your question to this site. Then so let's see. Yes, this is a question for online. How can planners in car-centric places like Malaysia promote cycling amid the challenges? Well, yes, so this is a very good question, and linking with the Netherlands example, how the Malaysia can. So yes. So this is the good question for international global other things. So Dr. Rohaida, could you try Yeah. Or, yeah. Huh? So please answer, please, this one first.
The second one.
That's not the first one. So then, yes, so while Malaysian representative is preparing the answers, and so questions from floor, yes.
Okay, good afternoon. Thank you for the presentations. And I think it's a wonderful insight to show how interconnected cities are with the well-being of communities. So I'm sharing a story. About 15 years ago, our arts teacher will ask us to draw a vision of what cities would look like in the future. And then we draw flying cars, robots, and etc. And fast forward to now, we are talking about bringing nature back to cities. So my question is not specific to anyone, but I would like to get some feedback, because we talk about, and I believe some of the examples shown earlier was about bringing blue and green spaces into cities. And with the climate extremes that we are facing currently, there is a high failure rate of nature-based solutions. So how do we avoid that to ensure that the cities that we build in the future are sustainable and are intended as what we hope they would be? Thank you.
Thank you very much. Yeah. Yeah. So difficult questions and follows. Yes. So yeah, are you prepared for the answer to this? That's the cycling one to Malaysia.
Okay. Yeah, my voice is not so good because my throat is getting dry. But yeah, I'm Prof. Andrew Kiyu from UNIMAS in Sarawak. In Malaysia, it is very difficult to do this because we were taught from young that if we study hard, there are two things that we can achieve. The first one is that we will have a good house, and the second one is we will have a car. So it's part of our culture. And then, the Malaysian government is promoting cars, the car industry, and so on. And when you go to countries like Netherlands and so on, and you see people cycling, I've been there last year, and you're thinking, how do we do this in our place when it is so hot? So if you go down south to Singapore, our neighbor, the sidewalks in Singapore are not as hot as in Malaysia. And I used to wonder why. How come Singapore have so much trees, so much greens? And then I realized that they are living skywards. We are living lateral, they are living vertical. And so their sidewalks are covered by trees compared to in Peninsular Malaysia. And of course, they have the good public system. And of course, people in Singapore don't cycle as much. But what I'm saying is that if we can cover our cycling path, just like Singapore managed to do, I think more people will cycle. We try and do cycling lanes, biking lanes in Kuching, the city where I live. We prepare the biking lanes, but very few people cycle to work. They cycle as a form of exercise, which is good enough anyway, because at least they use it for exercise. But to cycle to work is very hot, because by the time you reach the office, you'll be sweating, and then we don't have place to shower and so on and so forth. So that is our challenge. Of course, cycling is one, but to have a good public transport system is another one. And Kuching is building an art system, artificial rapid transit, which is using hydrogen. The first one in the world that's going to use hydrogen, and it's not using rail. It's going to use tires on the road as usual. So we will see how that works, because if we cannot get people to cycle, at least we'll have a form of public transport that is having zero emission. That's all I can say for now. It's a big challenge for us in Malaysia.
Okay, thank you very much for the answer to the challenging questions. And then, so we have, we have on the, so we can have very limited time. And so can someone say nature-based solutions? So, Dr. Kashima.
Thank you very much for giving us the big questions here. I think this nature-based solution, I'd like to discuss with all of you. Yeah, and then so yeah, nature-based solution. You know, there in Japan, so we have many natural forests still remained, but many of us, so we are forgetting about that. So nature-based solution. So we have a long history of the living with the nature so far, but in recent decades, so our lifestyle was changing. So I think also we have to a little bit back to the history, and then I think the people who had the nature-based solution are many things, but now we are forget about that. So just nowadays we are trying to encourage the younger people go to the nature and then realize the natural resources like a common natural commons resources more and more, because many of them they are forgetting, and then just they are seeing the big urban city or something like that. But in the surrounding us, we have many green spaces and blue spaces are reminding. So we have to recognize our the how can I say the resources more and more, and then we can develop the new plan based nature based plan more. We should discuss more and more. Okay, thank you.
Thank you. Thank you very much. And then thank you very much for the online. There are various and very important questions. How urban planner can contribute, and then how to solve how to realize it, and then also how to reach the vulnerable population. Well, so sorry, so because of the bad management of the time of that co-chair, I should apologize. But I think, and so maybe the discussion on the cities, how to make it happen, the urban planning, and then to reach the communities. And then actually there is a long-term the planning process and then involvement of multiple sectors needed. I think we need a platform to discuss on this issue in the Planetary Health Alliance. And then we hope, and so we can continue to our discussion, and then we witnessed some of the cities made a success, and therefore we can learn each other's. So thank you very much for joining, and thank you very much to speakers. And then I wish you to continue good communication. Thank you.